Hello, this is Dr. Jazayeri. I wanted to talk to you about Brazilian butt lift or BBLs. Well, first of all, let's start with the history. The Brazilian butt lift, everybody assumes it was done, well, it may have been done in Brazil before, but what happened in 1982, there was an American doctor in Miami who did a BBL on a Brazilian patient, and it was televised. And so that's how that began. So there's no lift involved, it's just augmentation. We're adding volume to the butt. And the doctor was American, the patient was Brazilian. So that's where that came from. Some of you may have known that in Florida, apparently there's been a high number of complications and deaths from BBLs. And the state or the medical board now has limited doctors, each doctor, to do no more than 3 BBLs a day. I've asked all my colleagues who do BBLs, the average time seems to be about 2.5 to 3 hours. Sometimes it goes longer, depending on how big the patient is. So, the first question is, well, how could anybody do even 2, let alone 3? I don't know how they do it in Florida. Maybe they have a lot of, multiple ORs and multiple doctors, but they limited it to, again, 3 BBLs per doctor. And that's just baffling to me. I don't know how that's doable or what the quality of the work is, but I'm hoping that at least will limit, the complication rates in Florida and in other places as well. But the other thing I wanted to talk to you is, the volume that's put into the butt. Yeah, my wife criticized me initially, and she said, well, why don't you put whatever the patient wants? They want big butts, just put whatever they want. And my response to her was, remember the same thing with large breast implants. All of my patients who had, when they were younger and had big implants now are coming back and they're regretting it because the weight, the weight of that implant, gravity, unfortunately, is our friend and enemy, depending how you want to look at it. And so the weight of that implant is going to take its toll. Now, with the breast, well, you can go with a smaller implant, you can do a lift, we do it all the time. But the problem with the butt is, as with time and age, that heaviness will sag. Then you have to do a butt lift, which will leave a scar all the way across the back, on the lower back and the upper buttock, and that's pretty noticeable. So I highly urge you, if you're planning to do BBLs, to just get a natural BBL. Don't overdo it. I don't do exaggerated BBLs. I always tell the patients, and I show them my photos, my BBLs are just very subtle and natural. That's because I'm looking for you as a patient's benefit, not just short term. So keep that in mind. Large things will sag, whether it's a breast, whether it's a butt, anything that's got mass, the gravity is going to pull on it. So keep that in mind if you're considering BBL. If you like more information, we have a lot of information and photos on our website, www.drjaz.com, drjaz.com. Thank you and have a nice day.